Okay, so I'm going to demo this sidelying exercise and explain it just a little bit. And if you want to hang around after that, I'll give a little bit more in-depth explanation as to why you're doing this to begin with and what it's really driving. So the first thing, you want to lie on your side, exhale so that your lower back is flat or even rounded, but not arched or extended at all. You shouldn't feel your ribs popping out. And then from here, and it doesn't matter which side you do this on because you're going to drive motion in both hips regardless of which side you're on. So whatever side's more comfortable. And then from here, you just want to think of sliding one knee as far forward as you can and then pulling it as far back as you can. So as you can see, my bottom leg just stays stationary, push into the floor with it to help keep it from sliding. And then move forward as far as you can until you feel a little bit of a stretch and the inside of the thigh, that muscle there, turn on. And then same thing, push your knee down as you slide back. And this guy's just staying stationary and you're sliding back and forth. So the purpose of this exercise is we're really driving this internal, external motion, but we're doing it by moving our pelvis or our hips back and forth so that as you drive forward like this, you're maximizing internal rotation on the inside or the down leg and external rotation on the top leg. And then as you pull back, it reverses. You get external rotation and internal rotation. So this is relative movement because we're driving it with your pelvis rotating back and forth and not just your femurs rotating or sliding back and forth like this, which also drives internal and external rotation. But most of the time, what happens when we're doing like real things like running, rucking, lunging, doing anything like that, is that your pelvis is moving on your femurs because your foot is connected to the ground. So it's not that your femur can't and lower leg and foot can't move a little bit, it can, but most of the motion during gait and those types of movements is driven by your ability to move your pelvis on your femurs to drive that motion. And so this exercise, by being unweighted and lying on your side, it helps you learn how to really shift those hips back and forth. It gives you a little bit of mobility because you're kind of getting to the end range of those motions and then pushing a little bit further. So it's a combination of teaching your brain how to really utilize or maintain that motion, and you can get a little bit of a mobility effect from it by driving to the end range of your internal and external rotation. You can get a little bit more motion out of it.